My name is Regina Homeyer, Jeannie, and I'm 54 years old, and I'm a patient of Dr. Mohart's, and he's the most wonderful doctor in the world. Well, it happened on February 14th of this year. Just to back up a little bit, I had a kidney transplant 20 years ago, so my situation is a little bit more complicated than most. Last year, June of 2009, Dr. Mohart had found a blockage. Thank God he did. It was a triple bypass, so it was pretty bad. Two of them were like almost 100% blocked. But thanks to him, he found that and got that taken care of. It's pretty touch and go because of the kidney transplant. They were trying to save the kidney at the same time. So got that all done, and everything seemed to be fine for 6 months. And then all of a sudden, I get a tightening in my throat, and I realized it was more than just tightening, that there was something else going on. So I called an ambulance. They came. They said, the hospital suggests that you come over there. I guess they could tell by what they seen on the EKG. So I went over there, and the ER doctor that was there, I don't know, he was kind of hateful because I told him that Dr. Mohart was my doctor and I wanted to see him. And he said, well, you can't see him. We've got other doctors here. He said, we got some of the best doctors there are here. Well, Dr. Mohart knows me. He knows my history. He knows, about the bypass and everything. And, you want your own doctor. I mean, you don't want to substitute. You wouldn't for, other things. So, but anyway, he's like, well, you need to be hospitalized, and I would suggest you stay here. He said, if you go by car, you've got nothing to help you on the way down there, to another hospital. If you go by ambulance, they don't have the right equipment that you need, is what he told me. And I'm like, wow, he surely does want me to stay here. So while he's out of the room, I get on the phone and I call Dr. Mohart late at night, wake him up and say, hey, what should I do? I'm here. He's really almost insisting that I stay, and you're my doctor and I want you to see me. He said, well, jump in the ambulance and go on down to St. Clair Hospital, because that's where he's at now, since he's the big to-do up here at the hospital. But anyway, so I did, but it was just that night the roads were really, really icy. The ambulance could only go about 30 miles an hour. But it was just all so stressful because I didn't know what to do. I mean, I knew who I wanted to see, but I didn't know exactly how to do it. And he was getting pretty stubborn. And then when he found out, I said, well, I'm just going to go on down. And he's like, I wouldn't suggest it, but you do what you want to do. And, it was pretty bad. I thought it was not very professional. So anyway, I got down there, and then of course again, Dr. Mohart saves my life again. Him and his team, they're wonderful. You're not a number with them, you're a name. I just think that the hospital is really messing up. I don't know everything about what's going on, but I know a hospital without a doctor is a disaster, and it happened to me. I mean, I was very lucky. I probably didn't have another heart attack worrying about what to do, and to get out on the road, it was very, very dangerous that night, and then I had to travel by ambulance, which would not have had to been done, with the situation the way it was. I mean, I probably will never go back. I know I won't for my heart. I'll have to travel 30 miles, and it's really an inconvenience for me and a lot of other people, and it would be really nice if things would have worked out different, It'd be nice if we could just come a few miles, to where our doctor is, rather than drive 30 miles to another hospital. It's a burden, Okay, and there's one other thing I wanted to go back and go over, because I'm not sure if I covered it, but on February 14th, when I did have this heart attack, I got to the hospital, and they had done x-rays and EKG and blood work, and I had a heart attack. I actually did. And what was really worrying me the most is that I wasn't going anywhere. I was laying in that bed, and popping nitroglycerin, and it's like, what are we going to do? He's wanting me to stay. I want to go. I want my doctor. He wants me to stay. He says, we've got the best doctors. I'm like, I don't think so. And so it was just, I got detained, and the more you're detained, from what I understand, is your heart muscle. I mean, it's dangerous. I could have maybe had another heart attack. I don't know what could have happened, but it was just not a good situation. I mean, I feel like it could have cost me my life by being detained so long and not knowing what to do and being stressed out just from that. And I don't have a lot of good to say about that hospital, but I know my doctors need a hospital, and if not there, somewhere else, because it's just doctors need hospitals, and patients need doctors. So it's just, that's just the way it is.